Good afternoon, everyone. My name is Dr. Stacy Green, and I'm right here in the city of New Orleans. I'm an infectious disease physician and practice right here in the great city of New Orleans, the Crescent City. I'm here today because I want to give you an update on COVID-19. We've been hearing a lot of stuff in the media. We've been having a lot of press conference with our public health officials as well as our president. And I just want to give you a firsthand of what's going on. As you all see, the community of New Orleans, we've been suffering a lot because our rates have been just as high as many other cities in the country. But I want to tell you what we want to do to help you. You probably heard a word before called social distancing. That's one of the greatest things that we can do at this time to help decrease the transmission of this virus. The CDC says that social distancing is basically remaining from congregate areas, avoiding mass gatherings, and also if you're around others, staying at least 6 feet away. Now, when we look at the science of COVID-19, we find that oftentimes when people cough or sneeze, sometimes those droplets can go about 3 feet away from the person who actually coughed or sneezed. And sometimes these viruses can be on surfaces and live there for hours or days. And that's why social distancing is very, very important. What social distancing does is a term that we use is called flattening the curve. What flattening the curve is decreasing transmission rates by decreasing exposure for others to the COVID-19 virus. So I want to encourage everyone today to use and practice social distancing, because if we don't, it can further overwhelm our healthcare system. As you all been noticing on the news, we've been struggling even as medical healthcare providers with having a limited supply of personal protective equipment. And that's why social distancing is very important, because when we do that, we decrease transmission rates, which will in turn help us to be able to manage using our personal protective equipment even the more. So like many mayors, many governors, along with our president, have been crucially saying over the past couple of weeks, social distancing by staying home. If you don't need to go anywhere, stay at home as much as possible. And I know kids are out of school right now, and it seems like they're getting a little restless at home. And sometimes there's an urgency or a tendency or even a temptation to invite some of their friends over. But you know what? At this time, because we're dealing with a crisis, it's very critical that we avoid play dates at this time. And I know I have 3 daughters myself, but at this time I have to tell all 3 of my daughters we have to avoid play dates because we want to practice proper social distancing. You know, a lot of times we like communicating with our family as well as our friends. And a lot of times we like doing that in person. But for this time period, instead of doing it in person, why don't we do more FaceTime? Instead of eating in diners, why don't we at this time get takeout? It's very, very important to do that. I know you all have heard the symptoms of COVID-19 in the past, but I just want to reiterate it for those who don't know about the symptoms of COVID-19. Some of the symptoms include fever, shortness of breath, cough, as well as fatigue. If you develop any of these symptoms, what I want you to do is call your medical provider for advice. Some of you are saying, well, look, I have these symptoms. I'm on my way to a healthcare facility so that I can get treated. Well, before you go to that healthcare facility, give that healthcare facility a call. Let them know that you're on your way. So number one, they can prepare for you, but not only that, protect others who are in their facility as you come in. A lot of discussion about, well, we have medications out there to treat it. Well, some of the medications that you probably heard the president talk about were 2 drugs in particular, chloroquine and hydroxychloroquine. And you probably heard the term repurpose. These medications, chloroquine and hydroxychloroquine, they're actually anti-malarial drugs. But some case reports and some case studies have shown that patients have actually improved while having a diagnosis of COVID-19 and using these particular medications. Those were case reports. But currently, there's no FDA-approved treatment at this time. So some patients who are hospitalized are getting the hydroxychloroquine and the chloroquine, but just keep in mind it has not been FDA approved yet. There's still clinical trials that we must do as a country before we actually open this medication up to be used by everyone. Also, you probably heard of a medication called Remdesivir. This medication is actually being produced by a pharmaceutical company called Gilead Pharmaceuticals. This drug at this time is not FDA approved. However, there are clinical trials that are being done to actually work to get this drug FDA approved. We're waiting for the science. We're waiting for the data. Some of you have been diagnosed with COVID, and you know, that's the reality. And you're saying, well, what do I do next? Well, number one, your doctor probably told you that you need to be in isolation. But I want to encourage you to monitor your symptoms. Remember, 80% of patients who have COVID-19, usually their symptoms are mild. So if you were not hospitalized for the disease and you're at home in isolation with COVID-19, monitor your symptoms. If your symptoms worsen, I want you to make sure that you call your healthcare provider as soon as possible and let them know the status of your symptoms worsening if they are. There are many people out there who are afraid. They're saying, I have symptoms, but I don't have any type of health insurance. I'm underinsured. Don't know if my insurance is going to cover this. I have nothing, no type of health care coverage. Well, look, that's why there are community health care centers in your area. Google wherever you are. You can, if you think you need to be evaluated for COVID-19, you can Google a community health care center in your area, because we want to make sure that everyone has access to treatment. Many times today, and I get it all the time, people said, Dr. Green, I have a household member who's tested positive for COVID-19. Dr. Green, what should I do? Number one, if you have a COVID-19 tested positive household member, if you have a bathroom and a bedroom that can be used, isolated for that particular patient, that particular household member, let them try to use their own bathroom and their own bedroom. You want to limit contact with other members in the household as much as possible. Practicing good hand washing and hygiene is very important. Making sure that when you use the dishes, whether it's the plates you eat out of or the glasses you drink out of, make sure that they're thoroughly washed. That's very important. If that household member has to have any type of contact with anybody else in the household, making sure that the person who tested positive wears a mask when they interact with others. For shared spaces that are in the house, make sure that there's good ventilation, good airflow, like an air conditioning or an open window. Limit the amount of non-essential people coming to your house. Remember, we want to practice social distancing. So these are some of the things that's going on with COVID-19. We definitely want to keep you informed. We want to keep you healthy. We want you to stay safe. One thing I say, wash your hands, stay home, and practice social distancing. Look, a lot of times right now, it's not so much the virus that's affecting the people medically. Sometimes it's just that anxiety, that worry, that fear, that uncertainty. So what we're going to be doing with one of our mental health providers, I want you to stay tuned in the near future. We're going to provide for you tips so that you can actually maintain proper mental health. Because, you know, oftentimes people are healthy physically, but mentally they're dealing with a lot of stress, dealing with a lot of anxiety, and we want to help you even with your mental health. So stay tuned, because we're actually going to provide some mental health tips with one of our mental health providers. Look, I wear two hats. I'm a physician, board certified in internal medicine and infectious disease. But not only am I a physician, I'm also a pastor. I pastor a great church in the city of New Orleans called the Impact Ministries of New Orleans. And I want to let you know what our motto is. Our motto is in the community for the community. Part of what we believe is what Jesus said in Matthew 25, is that when I was hungry, you came and you fed me. Look, I want to let you know today that as a not only as a physician, but as a pastor, I care about you. I care about your family. I know what it's like to have a need because of job instability. Yeah, I know what it's like. And some of you today, because of this COVID-19, you're dealing with issues even in how you're going to feed your family. When I want to let you know, next Saturday, right here at our facility, we're going to have a drive-through grocery giveaway. That's March 28th, next Saturday, from 11 a.m. to 12 p.m. Look, if you already have, that's fine. You stay with what you have. But I want to minister to people who don't have. I want to reach out to families that may have lost that job or their job has been shut down and they don't know how they're going to feed their kids. Well, we're going to be giving out groceries to people who are in need. Next Saturday, March 28th, from 11 a.m. to 12 p.m., right here at Impact Ministries of New Orleans. Look, let me tell you our address. We're at 4480 General de Gaulle. That's 4480 General de Gaulle, Impact Ministries of New Orleans. Look, if you need help, we want to be there for you. And there's some people today, you have been blessed with more than enough. You've been blessed. I like what Kurt Carr says. Kurt Carr says that when you've been blessed, you ought to bless somebody else. Well, if you want to partner with us to help the community, remember our motto is in the community for the community. If you want to partner with us to be a blessing to others, look, you can give online at our website. Our website is impactministriesnola.org. That's impactministriesnola.org. Look, partner with us because, look, I believe that during times of crisis, Christ is. This is the greatest opportunity right now, not only just for healthcare personnel, but those who are in ministry. Let's be the hands and feet of Jesus, and let's be a blessing to others. God has blessed us so much to be a blessing. Some of you today, you may have some questions, and you can always email me. You can email me at info@impactministriesnola.org. That's info@impactministriesnola.org. We're waiting to hear from you. Partner with us. We're going to be a blessing. We're going to build God's kingdom through loving Him and loving others. God bless you. Until next time.